live on Facebook now. All right, good evening, everyone. Welcome to another session of Phoenix Talks. Today, I'm not going to be your host. Hang on, we're just letting people join and I need to switch off the waiting room. That's always important. There we go. So once more, welcome everyone. Welcome to another session of Phoenix Talks. This time I am not going to be your host. Jennifer Gasper, our co-founder and president of the board of Project Phoenix, is going to take this one because our guest is a very special one and she knows him a lot better than I do. So I'm going to hand it over to her.
Thanks, Misha. Hello, everyone. This is my first time actually managing one of our Phoenix Talks, so I hope you'll be patient with me. But I would like to introduce somebody who's very special to me, very close to my heart, and a wonderful man named Evgeny Shtorn, who was forced to leave Russia in 2018. In 2019, he was granted international protection in the Republic of Ireland, and he currently works as a cultural diversity researcher at 𝗘𝘃𝗴𝗲 and co-facilitates the project called Something From There at in the National Gallery of Ireland. As an activist, he has been involved in human rights and LGBT advocacy for almost 2 decades, and he founded a grassroots initiative, Queer Diaspora Ireland, in support of victims of gender-based violence and LGBT people in direct provision. I've asked Zhenya I call him Zhenya, I've asked him to join us tonight to talk a bit about his background as an asylum seeker and the process of becoming an activist while he was an asylum seeker, and also his perspectives and views that he has on the situation with COVID-19 and people living in what's called direct provision in Ireland. And Zhenya, I'm going to ask you first if you wanted to just talk a little bit about yourself and your background in becoming an activist, but also could you define some terms for us? I think maybe the 2 most important ones for some of our viewers who don't know, the defining what's called in Ireland direct provision and also international protection. It's a basic term, but I think it's valuable for some people.
Yeah, okay. Thank you, the guests, and thanks, Jennifer, for inviting me. Let's start with, well, about myself. I think more or less everything it has been said, and yeah, like I always have certain struggles with you know, any labels or etiquettes, and kind of try to always escape them and redefine myself. But in a sense, if we have to think about what is activism or what is the human rights activism is just when you cannot accept the reality as it is, and you constantly try to improve it, to make it better, which is very natural, I think, human impulse, no, that we have. And probably this definition will help us to answer your question about the why, while in direct provision, I didn't stay quiet, and I kind of wanted to highlight and wanted to bring certain struggle together with a lot of friends and colleagues. I'm certainly not the only one. I have a lot of friends who are still in direct provision and they don't stay quiet, and I admire these people deeply. But to keep this conversation on the same loop, maybe that's what we have to do, is to define direct provision. And this is a system that was set in place 20 years ago. In 1999, they signed it, and in 2000, they implemented it. And it basically speaks by itself, the name, no? Direct provision, which means that everything which is considered as a main necessity of the human being is provided directly. Shelter, food, I don't know, towel, it all gives to you directly, so you have no agency, you have no right to decide anything about it. And the system basically is private run, so the state is distributing public money for the private corporations. One of them is Aramark, famous, notorious Aramark, who runs prisons in the US. So these corporations, sometimes it's a unifamiliar entity who owns the hostel. Sometimes it's huge enterprises like Aramark who receive public money to run the centers. One of the, let's say, arguments to establish the system was the fear that the Irish government at that time was having towards people in need of international protection, that they will overwhelm Irish welfare state. So in order to remove them from the other categories of people entitled for the welfare, they created this system. The system basically is, as I said, you have no agency, so you are given food 3 times a day, and if you lost the meal time, you have no right to claim for the food separately. You have no cooking facilities, so you only have canteens where you eat whatever they give you. And also you have basically very limited right to decide with whom you can share room. If you were lucky to find some roommates, so usually management won't oppose to that. But also, while you are distributed to one of these hostels, which are usually in quite remote zones across the country, you have no right to decide if you want to go to that hostel or not. So you are only given the prescription to go to certain place and stay there. And if you are lucky to find someone there, so you might have a good roommate, you might have a terrible roommate, you might have 3 roommates, up to 10 people living in one room. So it depends on a lot of factors. Each center is different. Each center has its own face. Some centers are male only. Some centers are for families and single women. There is no center for single women, and there is no centers that would be specific to any particular situation, which in the case of LGBT people or victims of domestic violence bring very clear difficulties, because people might be bullied, people might be bad treated by other residents, by the management, by whoever, you know. There is no special understanding of LGBT agenda or LGBT specific issues for the residents in direct provision. So over this 20 years, for almost 18 years, there were no, the people were receiving 19 euros per week, and that was all the cash they were able to carry. Since the second half of 2018, they started to make this, or even in 2019, 2019, they made it slightly bigger, 38 euros per week, but that's basically it. And if you, and in 2018, they introduced the right to work, which was a big struggle. But at the end, Ireland accepted the claim for people in need of international protection have right to access the labor market. And those who are working while living in direct provision have to pay, depends on how much they earn and what are they, where are they living. And there are a lot of, it's still very new, so no one really knows how it works. But the main approach is that people who are working and when they are still living in direct provision, will have right to, will have an obligation to pay for their residency, which might help them probably to take the decision and move out. The problem with the right to work that it's limited to 6 months and it has to be renewed every 6 months till you either given one of the statuses like refugee status, subsidiary protection, or humanitarian leave to remain, or deportation order. So there are 4 ways of end up being an asylum seeker. So 3 more or less favorable, and 1 is quite problematic, which is the deportation order. And also because of the whole because the process is inexplicably slow, sometimes people remain in this type of hostels for 5 years, 7 years. There are kids who grew up in this hostel, so there is a lot of trauma going on. And in the last few years, it was a real massive mobilization around the issue of direct provision. A lot of people are coming on board and are advocating against this. And one of the very visible political actors in this field is as well LGBT activists, LGBT community in general, because they got 2 strong achievements in the last history of Ireland. In 2015, Ireland became the first country of the world who approved the equal marriage through national vote, through referendum. And also in 2018, the 8th Amendment of Irish Constitution that was banning the right of women for their own bodies, the right of for abortion, has been also removed from the constitution. So the abortion is legal in Ireland, and it's also, of course, it's firstly and mainly women and feminist struggle, but it also was hugely, massively supported by LGBT. So this kind of feeling of being legitimate and successful political agent in the contemporary Irish history makes LGBT community decisively step into that field. And this is probably how I felt that I'm not alone in that struggle. From the very early days in Ireland, I met LGBT activists from different organizations, and they were quite supportive. And I felt, you know, talking to them, I was understanding more and more, because initially my idea was more about not against direct provision as such, but against that there were no specific center for LGBT. So I was mostly thinking that it needs to be set some kind of center that would be LGBT specific. But at the end of the day, I realized that it's that there is no sense of fighting for a special prison for LGBT, because direct provision essentially is a prison, and people are maintained in this institutionalized poverty without any right to decide anything on their lives, and we need to come all together against the system itself, and not that much advocating for this or that group. And another strong argument that really made me feel that, you know, there is no actual argument in favor of direct provision, because people, if we just make a very simple arithmetic exercise and we divide the millions that has been spent on direct provision of the public money by the number of residents, we can more or less roughly speak about at least 1,000 euros per person, which basically means that if people are giving this 1,000, most of them would very happily share room you know, living somewhere and have enough money to buy the food they want and to have and invite people they want to invite and really feel agency, feel different, feel free.
So if I'm understanding, you're actually talking now about this evolution of your own thinking, of going from, you know, working within a system that seems really, you know, very claustrophobic and unjust in ways because of the lack of agency, to just let's get rid of it altogether. And I think that's actually very interesting, maybe because it ties in now with the situation with COVID-19.
It is actually.
And how you know, if I know that, you know, thankfully you left direct provision just before all of this started to happen. And could you tell us a little bit about how, you know, how are people feeling who are all of your friends who are still in the system and in direct provision? Are they talking to you about what's, you know, what's going on? Are they being educated? Are they being given certain restrictions within their already restrictive environment? What is the situation now? Do you know?
No, the system works much more subtle, you know, it's very Foucauldian kind of model. You feel observed, you feel forceless, and then you keep quiet. But no, a lot of people are speaking out loud, and there were several outbreaks. There are at least, I think it's 6 now, 6 clusters. So there is a high number of positive cases of COVID-19 right now in centers, and even few weeks ago, when the situation was only about to start, there were unequivocally several initiatives that were highlighting that the direct provision will become one of the biggest problems because people are congregated together. There is no physical space for privacy. There is no capacity to cook and how you will eat. Can you leave the room, and you know, will the canteens remain open or not? And they were also one of the first things that we've done was we wrote a letter to the minister about the urgent need to move at least the most vulnerable, so people with pre-existing conditions, elderly, and so on. And then we also set up an we mobilized all 8 Irish universities and as well general practitioners and lawyers to sign an open letter to the minister with more or less the same argument, and it was very successful. Around 900 people signed it. A lot of professors and well-established researchers and so on and so forth. So that also had a certain impact. So the vulnerable people were moved out. And but a lot of people who are still there, they are still there. Yes, maybe their health is not as exposed to the COVID-19, and probability to catch up and have a bad impact is lower than when you are elderly, but it doesn't mean that their mental health is not affected. You know, they cannot really go outside for long, and they are still remaining in this closed environment, which will definitely have a long-term impact on them.
And
but there are a lot of positive cases right now. One of them is in County Kerry, which is quite far away from Dublin, and there were a lot of cases there. And one of the initiatives was to keep them all there closed, which also is very controversial idea, terrible idea, basically, to close the people who are tested positive with people who are not. And one of the initiatives that is taken by the government now is to test everyone in the center, including staff, and maybe they will do something about it in the near future. But in general, I think that this type of congregation, this type of living is absolutely unacceptable. There is no need, any need for that. There is no economic, there is no demographic. There is no need to remain these hostels open. People can be just entitled to every social welfare as they used to be before 99, and it can be resolved easily. And instead of that, the state would rather put money into the building social houses, because housing is one of the biggest social problems in Ireland. There is a lot of homeless people. And this problem needs to be addressed in complex with direct provision, because people in direct provision are essentially homeless. If you are not happy with direct provision, you can go outside and live on the street if you want. There is no problem with that.
Well, I'm just looking here that we have some questions that are coming in, and I'm wondering, let's see, let me just read it, or maybe it'll be sent to me directly. But while I'm finding that question, I wanted to ask you to talk a little bit more about your how, when you're in touch now with people who are, can you hear me? Hello?
I do, yeah.
Okay. When you're in touch now with people who are in the indirect provision, do they have regular contact? Do they have regular access to internet and these things that they would require as being part of the community? But while I'm finding that question, I wanted to ask you to talk a little bit more about your how, when you're Are you there? I'm sorry, I had a technical problem.
Yeah, someone was asking a question, but I wasn't able to hear it properly.
Yeah, I asked him, sorry, I had a technical problem, but I'm wondering if you can talk a little bit about people's access to communications while they're in direct provision, and especially at this time of quarantine. I mean, do they have reliable internet? How can they contact you?
Yeah, well, as far as I know, people are, it depends. Some people are using their own data, maybe some unlimited internet or whatever. Some people can use the centers, the internet and centers. I presume they put a bit better connection. I didn't hear anything about the lack of connection in general in internet, but of course it's not a strong one. So if you use the internet which is provided by the centers, that's usually it's very slow, so you cannot that would be enough to send a message, but that might be not enough to watch a movie and so on. And when you are staying for so long in the room with sometimes alien people, so the YouTube or stuff like that could be a possibility for you to escape. That may be not always possible for people there. And what was the other question?
So,
about
well, it's okay.
There are also a lot of grassroots mobilization communities around who are supporting, making some fundraising. There is also people in direct provision who organized in the county Cork, and they are doing masks for everyone in center, outside center. So there is a lot of community-based, very kind of open-hearted work by Irish people living nearby, by people in centers themselves who are mobilizing and doing stuff. There is also some, cleaning facilities and cleaning, how the disinfectant, the sanitizers and stuff that people were collecting. Some community groups were collecting and bringing to direct provision. So there is a lot of things that are done on the ground by people, by communities, but it's not something that the management would do or that they would care about. So in these terms, we have to acknowledge this massive community work that has been done on every level in every county.
And what do you think about the political will? So I have one question that came in that said that, for example, Portugal, the Portuguese government has taken strong measures to protect asylum seekers during this virus crisis through regularization. Are politicians in Ireland also responding to this call for a change in policy, or are they reluctant? And why do you think that is, if they are reluctant?
Well, they it's hard. We just had general elections in February. We don't have a government yet. So we have a government which was elected before. So some of the ministers right now, they didn't even pass, they wasn't re-elected as members of parliament, so they definitely won't be in government. So we have like a provisional government right now, which is also makes things a bit more difficult in a sense. There is this phrase of this duck, some kind of duck, when the president is already
lame duck.
Lame duck,
Yeah,
yes. So
yeah,
we have a very lame duck government right now. So in these terms, I don't know. I heard different things about Portugal. I think there is some controversy around it. Here, people in direct provision are entitled to medical cards, so they have access to the GPs and so on. As for the other issues, that could be an easy solution, of course, but I don't think they will do it. What is now in negotiation about this new government is that probably they will take some steps to end direct provision, which is our main claim. Now the problem is what they will substitute it with. But I think that the direct provision is really becoming a very annoying for them things, you know. No one is speaking bad, no one is speaking in favor of direct provision, and it will definitely end, but there are a lot of different views on how it has to end. And
do you think that in some way this pandemic will help push that forward a little bit? Because if you can demonstrate that the public health
but it can be also a huge argument for all the centrist government. It's not only about Ireland and direct provision. I think in general the centrist government might use the pandemic to explain a lot of things that won't be done because of the economic reasons. So I am a little bit more kind of pessimistic. Maybe it's my Russian side, I don't know, but I am in general quite pessimistic. But it doesn't mean that we won't push. We will keep pushing, and I am absolutely sure that one day or another the system will end, and people will be just entitled to have a decent life, not institutionalized, which is the main argument here.
I think it's fantastic that you've had this ability to push forward an agenda that I think is so important and would affect so many people positively. But I wanted to go back, if you don't mind, for a moment to the question about the clusters of positive cases in centers and in direct provision centers, because it sounds concerning. And if you marry that with the idea that it's direct provision, what is being directly provided those now that are in these centers? Are they receiving, masks? Is there, a flow of disinfectant solutions into these places? And can people who live there who aren't positive, or at least not demonstrating any symptoms, or can they continue to maintain some sort of distance or cleanliness and disinfect their areas? I mean, it has everything.
This is the most problematic thing, because
shared bathroom
the answer is, of
facilities
course,
and shared eating.
and there were a lot of cases when people were if they were tested positive, they were isolated in one room, so another room are becoming overcrowded, with the neighbors of the person who has been tested positive moved with another people to another room. That's like it's a mess, and there is no kind of clear understanding what they will do and how. They are taking more hotels now as an emergency measure to try to isolate people as much as possible. Also, since people were given the right to work, some of them became nurses and caretakers in residences and so on. So these people also are then coming to direct provision, so they are at risk at their workplace, but then they can bring the virus to the centers. There is kind of a lot of it's just the pandemics make very clear that this type of congregated living is not suitable. So it needs to be transformed. It needs to end as a system, but it also we cannot create a new hostels, whatever it is. So it has to be, and I think it's in general to understand that on a global maybe matters. You know, it's like we can really think about communalkas in Russia, which is a very similar, in a sense, you know, way of communality where you cannot escape. Sometimes the bathrooms and showers are on the floor, so there is 20, 30 people maybe using them. How can you really protect anyone from the virus when it's organized this way? So I don't really think it is.
So I have a sort of a kind of a an observation and a question. One is that, you know, there's a lot of talk, of course, in mainstream media everywhere about how this is going to be our new normal, that life is going to change from here on out, and things are going to be different, and we'll just have to learn to live with it. And that's, of course, for everyone, not just, you know, people living in direct provision. But if you can take that understanding that this is a new normal, this necessity for social distancing, this necessity for a certain level of hygiene that we didn't have to practice before, and couple that with maybe some, well, maybe we should have been practicing, I don't know, but we, you know, and you couple this with this idea that, you know, how can we use this moment to, as like an international community now, I'm not just talking about the system in Ireland, because there's similar systems in other countries around the world, but how, you know, what is it that we can do as people who actually care about the fate of asylum seekers? How can we, you know, get together? Is there something that we can do to demonstrate and compare and contrast and show that this is a very important moment where this very marginalized population in our countries that need special care and attention, and yet that special care and attention that they've been given is now deadly. So how can we change this conversation? What is your advice to the international community of activists that are interested in this issue?
Well, in the European Union, I think that there is an easy answer and a much more complicated, detailed answer. But the easy answer is treat people in need of international protection as people, first of all, you know, and that's it. You know, there has to be no stigma. They don't have to feel guilty for ask for help. Especially you know, in a circumstances that they are. The problem is that unfortunately they are not seen, or we are not seen as people as such. You know, there is a lot of paternalistic approach. There is a lot of need of kind of take care instead of promote agency and, you know, empower these communities and help people to start their life, not keep them for years in this limbo when they don't know what will happen with their case, what will happen next, how they will integrate. It all creates a very serious long-term issues that really impacts all their life. Then it's very hard then to come back to the labor market. It's very hard to really combine a CV and so on and so on. One of the first things that has to be done is, of course, to make the process as fast as possible, and also to be very transparent, be very clear what is the arguments, while the cases is being proceeded. And also about the new normal, I really don't understand what does it mean. Like, normal is normal.
None of us do.
What is new normal? Like, you know, it will be just something new. It definitely won't be the normal we had, but will it be the new normal? And what, like, can we even speak about new normal? I don't know. Like, it's not a critique to you. I mean,
no, I understand.
It's just yesterday on 𝗘𝘃𝗴𝗲, the prime minister was also using this term, and this is for the first time. I was like, what does it mean, new normal? Like, I don't know, and I don't know if anyone knows. What we clearly have is that, you know, this is something that will definitely impact every single individual. At least in the European Union, it's a huge challenge for the welfare state. It's a huge challenge for economy, and we don't know what will happen next. We don't know. But if we have certain principles, and these principles are deeply humanitarian. We need to stand up for everyone who is in need right now, you know, and it's not only people in need of international protection, people in direct provision. It's also undocumented migrants. It's, you know, there are cases right now, as far as I know, of international students who were coming from Latin America, for example. So they apply for the visa and they have 20 hours work permit. But because they arrived recently at the end of February or the beginning of March, they didn't arrange all the documents, and they cannot apply for any type of support. They cannot find job. They can do nothing. You know, like it's a huge crisis, and we need to somehow bureaucratically provide a support for them. But it's not. It hasn't been done yet. So. And this charitable model of, you know, making crowdfunding and give them some food, which is a good thing to do, but it's not enough.
It's not enough,
and it always has to be addressed as a systemic change. It also has to be acknowledged as a systemic problem, bureaucratic problem, and not just the problem of that some person has no food. You know, it's of course the first thing you do is to give this food, but then what can we do to eradicate the situation as such? You know, so this is there's always two steps, but what my main message would always be, we cannot stop at that level of providing food or, you know, giving small bits. We need to always analyze the situation and address it on a much more systemic level.
Well, Zhenya, I'm not being too complimentary. I'm just observing that I think that the community of asylum seekers and migrants in Ireland specifically are very lucky to have you as such a persistent activist, a very persistent voice and inconvenient voice, which I think is perfect. And I'm so glad that, you know, that your activist background has given you this voice where so many people remain voiceless. So I think you're in a wonderful position, and of course I celebrate the fact that you've received your status and now that you're free to work and to.
I even received my travel document, but
I know. Well, I'm waiting for the borders in Germany to open up so that you can come visit.
Absolutely.
So
thank you very much. Thanks for Project Phoenix. If we finished, if there are more questions, I'm happy to.
Are there any? Let me just check if there are any more questions for now. No, but you know what we might do is follow up a little bit later, and then write some questions to you, and then we can kind of put it back on our website and on our social media, so that people are a little bit more informed about what's going on. But
stay safe, everyone. Take a good care. Wash your hands.
Wash your hands.
We'll be
practice
back
hygiene
soon. Bye.
Bye. Thank you.